Hey, what's going on, family? So I am shooting this video because two things. One, y'all know I've been dealing with this knot issue that caused that migraine for probably over a month now. Y'all were kind enough to bless me with 2 massages for my birthday. To no avail. Definitely felt some relief, but it was never totally gone, right? So this is my buddy Tripp.
How y'all doing?
He works here at God's Fitness with us. You'll probably see him in the main part of the gym most of the time. But I know that Tripp works as a professor in biology, and I know that he works on some of his clients, but in the manner, I was unsure. So the pain was just like bugging me. I'm like, Tripp, tell me a little bit more about what you do with your clients when you're working with them. And that's why we're shooting this video. I need you guys to see this, guys. Long story short, let me jump to it. He told me he does this thing called cold laser. He's like, look, man, I need 30 minutes. And the thing you got to know about Tripp is what you see is what you get, and that's what I like. He ain't a salesman. He's just like, yeah, man, you'll love it. It works really good. 30 minutes. You should be pain-free. And
you're actually a bit of a skeptic when I first started telling you.
I didn't say I was a skeptic, but I was the pain. I'm glad you said that. I was in so much pain. The cost of a 30-minute session, $65, was like, I'm not gonna cry over $65. If this thing really works, it's gonna be worth what, we pay triple that for a freaking massage with tip. So anyway, long story short, he works on me in 30 minutes. Immediately, the knot that has been sitting there gone. I do want to add that I've probably got so much stuff going on here. In the next couple of days, I did start to feel knots in other places. But I really want him just to talk about this machine, guys, because I always stress, you got to massage, you got to do massage, you got to foam roll, you got to stretch. But in 30 minutes, a knot that has been bugging me for over a month was gone. So this is crazy. So Tripp,
Tripp.
So what's going on? Break it down. Like, first off,
so
the laser. Where did you get this from?
From a company called Multi Radiance. I'm in their network.
Okay.
I used to give talks at trade shows before COVID, and attached to the trade shows was like a sales conference.
Okay.
And so they would always have a booth at the sales conference, and so I got to know them over a few years. Every 6 weeks, we were traveling to a different city, giving talks, and same trade show around, same people around.
So this was from kind of more from the teaching platform.
Sort of. I was teaching at different trade shows, and the salespeople, setting up their booths would be there all day, and we just sort of moved as a group around different cities around the country.
Okay, bet.
Yeah.
So met these guys. They told you about this.
Oh, the laser. It took me about a year for them to sell me one because I wasn't a doctor, and but they realized that I had a solid command over the anatomical language because, like Fred said, I teach anatomy, A&P at TCC, and so talked with them, went to Florida for a 2-week training, and here we are 6 years later.
So basically, this is something that was usually only sold to doctors.
Correct. It's an FDA-approved medical device.
Okay.
And so it's a class 1 laser, class 1 infrared. It blinks infrared light.
You don't feel anything.
Cold laser. You don't feel anything.
I didn't. My wife was like, "So what did he do?" I'm like, "He just kind of pressed on me."
Yep, put this right there on the skin. You got to be attached to the skin, and it really does magic. So those knots that you were talking about, that the massage therapist can rub and kind of find, like, yeah, there it is, I feel it. And when you're done, you're like, yeah, it feels a little better, but that knot's definitely still there. Because foam rolling is important, like you said. Massage is important, like you said, to help with blood flow and things moving around the body, but it doesn't get rid of trigger points and knots. This does. So, the massage will feel better, but that knot's still there.
So how does, like, that's the part I want to kind of really touch on, because, so shout out to my massage therapist. Her name is Jamie. She's over here at the Woodhouse. In the 20 plus years of me getting massage, I have never been on a person's table who is as thorough as her. Like, she'll find the knot and not just work on the knot. She'll like try to find okay, I think I know
what tissues and look down.
She's digging deep, and there's like, oh, the knot's not all the way done. And she was like, I did as best I could in this last hour and a half, but.
And there's tons of value there.
There's never full release from this injury, at least. So I feel like, break that down. How does this in 30 minutes do something that a massage therapist who's thorough
Sure, and it's a different therapy. It's like saying massage and chiropractic are similar. They're body work. That's how they're similar. That's it. They're completely different practices. This is body work. That's the only similarity. It's completely different.
Okay.
So what I do is I'll still find that knot. I'll palpate around the skin and find it there, and I'll set the laser on it and hold it for a minute or two. And what that's doing is it's setting off what's called a cytokine storm in your body. Cytokines are like signaling cells saying like beep, 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 and they're calling in the anti-inflammatory markers, helper T cells, white blood cells, things of that nature.
Okay.
So if you bang your shoulder, we set off a little mini cytokine storm of 10. My shoulder hurts and I'm calling those signaling cells to come heal the area. It might take a few days. This is gonna set off, making up these numbers completely now, but a cytokine storm of, call it 1,000, from 10 to 1,000. So from a couple of days to a couple of minutes is the healing process.
So it multiplies
with big force. Yeah.
Okay, what else should we know about this really cool?
So that's inflammation, anti-inflammation work, and that takes rid of knots, call it like slip discs, vertebrae, just tight muscles.
Disc?
Yeah, I can encourage them to slide back in, like 2 vertebrae and the disc there, when they kind of pop out, you get rid of the inflammation and it now has room to go back in.
Oh, that's sick, bro.
Yeah, and that combined with either massage therapy or chiropractic therapy is the 1-2 punch.
Okay, keep going. I'm sorry.
So yeah, no worries. And so that's inflammation, right? Inflammation is the basis of all disease, and that can create great pain in our body. Where you're like, oh, I've had this for 3 or 4 years. Inflammation, like it doesn't just go away unless we do something to get rid of it. Like really, that can be swollen, different than swelling. Inflammation, it can be deep seated at the cellular level where you don't notice it per se. You just hurt.
100%.
Yeah.
100%.
And then the flip side of that is anti-inflammation, called stimulatory. So just change the hertz on this and it looks the same. So that's a anti-inflammatory setting. Looks the same blinky light, still you don't feel anything. This is sending, so damaged cells, it signals them to repair themselves. Torn, like let's say meniscus in the shoulder or meniscus in the knee, it encourages that tissue to regrow and heal back together. So I've taken a lot of people who were getting meniscus replacements or some sort of knee surgery. Well, no, they don't need to go to the operating table anymore. So this will rebuild that tissue rather than having to get a replacement. It rebuilds what you already have. It's the ultimate holistic healing tool. It looks fancy, it's scientific, it's FDA approved. No shot, no injection, no surgery. It's encouraging your body to heal itself from the inside.
Okay, so this is the thing. So I'm all about like trying to find a way, especially for my clients, before the pill or the Ozempic or name the new latest da-da-da.
Sure.
And I love a holistic way. Why is this not talked about more? Do you know?
Yeah, the main reason it's not talked about is insurance. So there's no CTI codes. I think it's CTI. Either way the word is, you can't bill insurance for it. So hospitals don't even use them. Because you can't bill, what's the point? You'll see them in chiropractic offices.
The point would be actually helping people,
sure,
healing people. But if they can't make money doing that,
like, yeah, and there's no repeat, right? It's sort of a use as needed. Whereas you need to fill this prescription up 3 more times. You need to come back and see me in 6 weeks. You need to go see a specialist so you're in that system. This is a one and done.
So you're saying like, man, this probably wouldn't make them a lot of money.
It would only help people.
Oh man, that's
so
interesting. Yeah, that sounds like me. Y'all know me, man, on that part right there. I love it, man. So what else do we need to know about it? Is that pretty much it?
That, and so we've talked a lot about skeletal muscle, right?
Okay.
We've talked about joint pain, how to heal that kind of stuff. Tennis elbow, golfer's elbow. Give me a part on your body that hurts and I can fix that. On the flip side, what else hurts? Well, I get anxiety sometimes. I get stress. I know people that have gotten PTSD. I know people that have panic attacks. A little while back, I took a lady out of a full-blown panic attack by taking this from the vagus nerve all the way down to the sacrum on the outside of her spine. 2 minutes on one side, 2 minutes on the other side. She was back to breathing deep. She went and picked her kids up from school. She didn't go home and take a Xanax. Changed her life.
That's sick, dog.
PTSD. I've had somebody who got more out of 6 laser sessions than she did out of 9 weeks of cognitive behavioral therapy. It took her PTSD away. General stress, anxiety. So turn around for just a second. Let me just show the camera. So from here to here, all the way down that spine, just like that on the outside, called the dermatomes, it helps with anxiety. So when you're stressed out, you're in what's called sympathetic tone. Your sympathetic nervous system is overactive.
Okay.
Well, you can't do a lot less, right? You can't just unstress. You can reduce the sympathetic activity with assistance, right? So sometimes that assistance looks like meditation. Sometimes that assistance looks like Valium and Xanax, right? Some things are better than others for you. This reduces what's called sympathetic tone. So the Purkinje fibers on the heart are overactive and beating the heart, making us feel stressed, creating cortisol. This reduces that electrical stimulation, so now the heart's calm, and parasympathetic activity, which is rest and digest, naturally blooms because you've reduced that sympathetic tone on your nervous system, if that makes sense.
I mean, yeah, it does. I'm more of like, it can help, but a freaking, I used to do
Panic attack.
major panic attacks, but thank God I don't go through that crap anymore. That's pretty dope, bro.
Yeah.
Okay, I love it.
And
What
that,
else?
I mean, and you reduce that sympathetic tone, inflammation starts to go away because you're not so stressed.
100%.
You sleep better that night. Not that you're tired, but your circadian rhythm is sort of
Bringing that
reset.
cortisol levels down.
Yeah, it brings cortisol down because it's reducing the stress.
Yeah.
And that has an upregulation effect on the endocrine system, which is the hormone system.
I want to touch on this again too with y'all guys. Listen, and I don't talk about it a lot. When I left LA Fitness as a district vice president, I was never missing a workout. I was so stressed out, and my stomach was so bloated and hard, and I was eating clean and working out, doing all the things.
That's cortisol.
When I left, I didn't actually leave. I went out on stress leave first. In 2 weeks, my stomach went away. My stress levels. So I really need y'all to think about, like, I want y'all to hear what Tripp can offer because he's got some really cool things to do, but I need y'all to think about your life, the environment that you're in right now. If it's creating more stress for you, it's going to make it harder for your body to work optimally. It's going to make it harder for you to see results, for you to feel your absolute best. So just put that in there. Love it.
One touch on that, one
Yeah.
thing I like to do whenever we're doing any sort of pain work or inflammation work is finish it with, that's called what I was just talking about on the spine, it's called a nervous system unwinding. You're unwinding that sympathetic activity to be more calm.
Nice.
So that will help anything heal faster and better. So whenever we're done
Less
doing
stress.
inflammation work, we hit the spine to bring that stress level down, to bring that cortisol and reset the endocrine system. So then it takes better.
I love it.
Yeah.
Okay.
So
Man.
pretty much everybody gets that de-stress. It's only 4 minutes it takes to do that after we're done with whatever work we're doing.
Okay. What else? What else we need to know?
You know, I think that's the main gist of this. You know,
Okay.
it's got to, just based on inflammation or stimulation, stimulatory or inhibitory, there's a whole host of things this can do, from skeletal muscle to the mind and the nervous system. And it really is an incredible tool.
Let's go. So listen, guys, the reason why I did this, I'm gonna be honest. When he did it, I got up. I'm like, oh, he said, move your arm around. I'm like, oh man, that's crazy. That's gone. Went home, baby. Remember the knot that's been there? Touch my shoulder. She's like, oh my God, it's gone. I text him immediately. I'm like, hey, Tripp, I want to champion you. I'm one of them people. If you share something with me and it's good, I'm gonna tell everybody. So here's the thing. I want y'all, because y'all are my clients, I want y'all to have access to this. I've been pushing massage and I push anything that I believe in. This guy I believe in. It was the best. I just spent $130 now because I did 2 sessions. Best money I spent ever. But this is the part that I love for you guys. If you see him, and he said this, if you don't feel any pain relief, don't pay me.
If I can't help you inside of 20 minutes, you don't owe me any money.
So I really want you guys, especially like, I know Mark, your freaking traps have been killing you. Liz, I know we've been dealing with the same issue. All of y'all, like, if you're feeling any freaking pain, like, I'll get his number to you. Set up a time with him. He's here. I'm not getting anything for this. I want my people to win. I want my people to have the access to the absolute best information, technology, anything that's going to help you get the absolute best results. So I love you, Tripp. I appreciate
Great.
you. Thank you so much. And I did do upper body today, and I'm thinking I might want to see you tomorrow, but
Let me know.
boom. All right, y'all. Y'all have a good one. Appreciate y'all. See you soon. Peace.